Hi, my name's Lee Matthews and I'm a physiotherapist, and this is Pilates Rehab Relax. So don't forget to click like and subscribe for all of our latest content, including Pilates sessions, relaxation videos and rehab videos. I'm going to guide you through some gentle stretches that you can do for your back in seated. The aim of these would be that sometimes people get stiffness or pain in their low back and aren't really sure what to do to best manage that. Well, we know from a physiotherapy point of view, if you can do some really gentle stretches to bookend your day, you might do them sat on the bed, you might do them in your chair at work, but by doing regular gentle stretching, it can relieve some of the tension and discomfort that people sometimes report. So first of all, get yourself a decent chair and sit yourself down. So I'm going to put myself, so I'm sat just at the front of the chair. There's plenty of room behind me there so I can move. And the first stretch we're going to do is a rotation stretch. So take one of your hands, pop it over the opposite knee, and then as you relax, try and twist around there. Now you move to what movement's available to you and hold it on the soft edge of that stretch, aiming to hold it for about 10 seconds and then back to the middle, and the same on the other side. So take your hand, pop it over the opposite thigh and gently trying to move around. So with all these stretches, we move in a comfortable position to what we call the soft edge of the stretch. Don't forget to relax into the stretch and also breathe when you're going there. The temptation is often to tense up or to stop breathing, and you'll never get as much out of a stretch, and it will probably be more uncomfortable if you do that. So the same to the other side again. Hand onto the thigh, round we go. And back to the other side again. So the first time I stretch, sometimes I find you can go less far and you might get pops and creaks even the first time, and that's fine. What you might find is with repeated stretching or even through the course of a day that you can actually go a little bit further sometimes. That's good. So that's our first stretch, which is rotation. The next movement we're going to do is a side bend. So hand down to the side of the chair, and you can either be holding onto the chair with the other arm or you just have your hand on your lap. But as we breathe out, just gently going down towards one side, and you should feel this all down the side of the back there because we're stretching some of those muscles, we're working some of those joints. And then back to the start position, and you'll notice that with all of these stretches that we relax into them but we never bounce. I think traditionally back in the 80s there was an awful lot of bouncing that went on with stretching, and we can get all the benefits without bouncing, and bouncing can sometimes put a bit of stress and strain on things. So just relax into the stretch, and sometimes when you hold it for a few seconds you can go that little bit further and back to the middle again. So I don't mind some temporary discomfort with these either, but I would suggest that if you're still sore or if you've noticed your symptoms are worse after doing them for more than about half an hour, then you're probably pushing too far with them, and it might be you just need to go more gently or adapt the position slightly. That's good. So that's our second stretch over and done with. We're going to move on to doing a gentle knee hug. So I'll turn the chair around sideways so you can see what's going on a little bit better. And what I'm going to do with this one is I'm going to bring my knee up towards my chest, and you can either apply pressure under the knee or on the shin. I would suggest though that if you've got a bad knee, you'll be more comfortable with the hands on the back of the thigh there. So again, I'm going to hold this for about 10 seconds. And this is stretching into the hip, but also around some of these glute muscles and the low back where it can get quite tight. And then the same on the other side. So again, my knee comes up to my chest and I hold that in gently. So if you've had a hip replacement, you won't go very far with this one, and you respect the movement that's available to you with that. But generally speaking, if we can give a little gentle stretch with this, it can be really helpful. Now, if you were looking to go a little bit further with that stretch, you can actually bring the leg up and bring the heel across the other knee there. So we can actually do a stretch much more into the glutes with this one. So this is a good position. Can you see my knee's nice and high? My ankle is crossed over the other knee. And what I'm going to now do is bend forwards and twist so that my shoulder comes towards the opposite knee there. So you'd be welcome to just stick with that knee hug on its own, but if you wanted to target those deep gluteal muscles, then this is one way that we can do that. So nobody is perfectly symmetrical, and what you may well find with this is that one side's tighter than the other. So I'm swapping over the other leg. So again, you might just stick with the knee hug to chest, and that's fine, but if you wanted to do that deep gluteal stretch, what we're going to do, we bring the leg up nice and high, we pop the ankle over the opposite knee, and then I'm going to lean forwards and bring my shoulder towards the opposite knee. So that's a really nice deep stretch into the glutes. And relax again. So I think with all of these stretches, you can pick to do the more advanced one, you can pick to do the basic one, but just aim to try and do 2 of each of them twice a day if you can manage. So we're going to move on to doing a gentle exercise for our pelvis now. I think what I'm going to do is just turn around slightly so you can see me from the side there. That's good. So notice again, I've got that gap between me and the back of the chair. And what I'm going to do now is a very gentle roll back on my sitting bones. So actually it's almost like a slouch really. And then I come back up into the middle position, and then like a sergeant major on parade, I'm going to sit up nice and tall. So again, you can either stick with just doing a couple of those. So I'm gently going backwards, rolling onto my sitting bones, and then back to the middle, and then up nice and tall like a sergeant major on parade. Now I'll do a more advanced version of that stretch. Would be as you roll backwards, if you imagine that you're hugging around a beach ball. So that's a stretch for the whole spine now. It's a really big stretch. And then the counterpart for that stretch would be as we sit up nice and tall like a sergeant major, to stretch the chest nice and wide there. So I can feel that all the way from the base of my back, all the way up between the shoulder blades, and relax. So again, that's a movement of flexing forwards and extending for the whole of the spine, and it's quite a nice one. Now, with pain, sometimes we avoid certain movements, and very commonly with back pain, people avoid bending forwards. That can actually, over time, develop into quite a lot of stiffness and tightness, and eventually can lead to people struggling to do things like put their shoes and socks on. So we can do a really gentle, controlled stretch leaning forwards. So start with your hands on your knees, and I want you to just slide them down your shins for me. So it's just a nice, gentle slide. Now that might be all you can comfortably do, and that's absolutely fine. But if you're able to do so, you might go all the way down and just be able to hold and relax. And then again, engage those tummy muscles and bring yourself back up again. And then one more time, bending down, and on any given day you might have different amounts of movement available to you. We'd always be encouraging that even on a bad day when you're having what we'd call a flare-up, that you still do some gentle stretching, but it might just be that with any of these things like the knee hugs or the slide down, you might just do a quarter of the normal movement, because when those muscles are tight and the joints are stiff, they don't often want to move that much. But what we would say is that by gently establishing some movement, you can often find a flare-up will actually pass quicker than if you just avoid movement altogether. We've done some nice back stretches, and what we're going to do now is do some stretching of the leg muscles as well, because quite commonly with back pain, especially if it's associated with sciatica pain into the leg, you can get some tightness of the leg muscles as well. So the first one we're going to do is a stretch of our calf muscle. So I'm going to bring myself, so I'm on the edge of the chair here, I bring my leg out in front of me, and then you can use a belt or you could use a dressing gown cord or a scarf, but I'm going to have a belt like a stirrup around my foot there, and I'm just giving some resistance on there, and you should hopefully feel a stretch into your calf. Now you can do these in standing, and it's probably a little bit more convenient to be honest, but do what suits you best. And I think that we're just aiming for you to just work to the best of your individual capabilities. And the bottom line is, as long as you can feel the stretch in the back of the calf, then you're doing it right. And then I'm going to do the same on the other side. So like a stirrup, I'm popping this belt around the underside of my foot there. I'm sat on the edge of the chair, as you can see, and I'm just going to apply some pressure there. And then back to the other side again. Yes, we know that with stretches it can be really useful actually, and it can help to relieve muscle cramps as well. It can make us sleep more comfortably. So you might think it's a bit strange to do stretching when we've got pain, but actually there's lots of benefits there, both short-term and long-term. What we do know though is that even doing a regular stretching program, to see the benefit of it, it could easily take about 8 to 12 weeks to really see that benefit, and that's doing it every day. So hang in there, and I think just make sure that you pick the right level to start at so you don't flare up your symptoms. That's good. So that's our calf muscle stretched out. The next thing we're going to do is stretch out our hamstrings. So these are the big muscles that are along the back of the thigh. And the way I'm going to go about that, again, I'm sat on the edge of the chair here. I straighten my leg out and keeping my back nice and straight there, I'm going to bow forwards. So can you see there's a nice straight knee here, straight back, and I've leapt in and actually done the harder version of this, which is my toes up to the ceiling. So I'll just do that for the moment. And then the same on the other side. So we can go further if we bend from the back, but then we've lost that isolation of the stretch. So I'd always say keep that back nice and straight there and try and bow forwards until you can feel a stretch on the back of the thigh there. So we can take some of the tension off by having the toes out in front of you. So again, I'll do the same thing, but this time my toes aren't pointing to the ceiling. I keep that nice straight back and I lean forwards until I feel this tension on the back of the thigh. And then the same on the other side. So I'm not setting a stopwatch when I'm doing this, but I'd say 10 seconds. If you're in a hurry and you did something less than that, that's fine. The bottom line is you're going to get more benefit from doing any stretching than nothing at all. And then relax again. Well done. So there's one last stretch to do, and it's for a really important muscle group called the quads. The quads and the hip flexors are on the front of our thigh. When we're sat down for long periods of the day, these muscles can get really tight, and then when we go to stand up or lay down flat, that can actually put quite a lot of tension on our back. They can be quite a challenging group of muscles to stretch, so there's various ways of doing it, but this is a good one, to be honest. So what I'm going to do now, I'm going to sit myself sideways on the chair, so it's a bit like I'm in a squatting position really. So my thigh and my bottom cheek on this side are firmly on the chair. You might even want to hold on to the back of the chair, or even have a table in front of you that you're holding on to. And the way we get this stretch is for this thigh is by bringing that leg underneath us. So what we're looking for is a nice straight line from the upper back through the hip and down to the knee there, and hopefully you can feel some stretch on the front of the thigh there. So you can make this easier by bringing the leg slightly forwards, or harder by bringing the leg further behind you. But all the time we keep our back nice and straight. What I don't want is you overarching from the back, because that's going to put more strain on here. So that must be 10 seconds, so let's turn around and do the same on the other side. So same again, make sure you're safe. Maybe hold on to the back of the chair or have a table in front of you. And what I've got is my thigh resting on the chair here, my bottom cheek's resting on the chair, but this other leg, I brought it out and behind me, and I can feel that stretch all along the front of the thigh there, keeping my back nice and straight here. So again, like all of them, we're going to do 2 on each side, guys. That's good. And back to the other side again. So you can do this one in standing by holding on to something and bringing your leg up behind you. I've recorded another video with all of these in standing as well, so by all means feel free to have a look at that. I'll put a link up at the end. That's good. And one last time. There you go, and we're done. So remember, work at your own pace and find a range that's good for you. But yeah, little and often, and you're the boss with all of this. So by all means, if you'd rather do them laying down on the floor or standing up, then check out the links that I'll pop up in just a moment. Alright, take care guys, and thanks for watching.